Howie Ganner, CEO of the Arc Jefferson St. Lawrence. And first of all, I'd like to thank NCI, its board, for approving our grant proposal, which really was to improve the health of the people that we support in the most effective and efficient manner that we could. Our grant consisted of purchasing laptops and tablets to assist our staff in monitoring and managing the health needs of the people that we support, as well as improve communication between the people we support, our staff, and the clinical staff that monitor them. So it's proven very effective. Our nurses are a primary user of the devices. They use the laptops to manage the health of the people we support by checking and monitoring their health on our electronic health record, which is TheraWrap. They do that on a regular basis. The other key component that our nurses have done is they are attending medical appointments much more consistently because they can attend via the device, either the tablet that the residential staff have or with a laptop if they're attending in that mechanism too. In regards to specific objectives that were established for the NCI grant, we looked at, as I said before, reducing the amount of time that nurses were spending in the sites. That time went down 15%. And as I mentioned also, the mileage that was being driven by the nurses prior to the use of the tablets and laptops, that's gone down 48%. So that was very significant and is going to help us in reducing costs related to the healthcare. In the area of attending appointments that I mentioned, they went up 64% compared to where they were previous to getting the laptops and tablets. The other area that I did not mention is the grant provided tablets for all of our residential sites in both counties, 51 of them. Those tablets are used by both staff and the people we support. One thing we noticed was the request to communicate between each other. So our day programs have not gotten back to normal, and the people that attended those day programs miss each other tremendously and want to interact. So we're trying to encourage them to use the devices between the sites so they can meet with their friends and talk. And the other thing is using those devices for things that they want to do on a social aspect. I think the best benefit out of the grant was the utilization by the nurses in the homes, but the nurses really have bought into the project. The management and monitoring of the health needs of the people we support has been greatly enhanced by this grant, and it's also been able to reduce costs in monitoring and managing those things. So we're very thankful and appreciate all that the NCI grant has done for us.
So RNs are also able to utilize the laptop tablet connection to provide on-the-spot trainings to DSPs, any questions that they might have, any changes that occur throughout the day. They can connect with the RN and the RN can do virtual training instead of delaying that training when she can get to the house.
Basically, they've used it the most for working remotely while able to access all the medical information that they need.
The biggest thing that has changed is that they do virtual assessments on the spot. If they get a call from a staff and someone has a bruise or a concerning area that they need to look at, or anything that the staff may be concerned about, they can hook up a link immediately and be right there in the moment and see what's going on and make an assessment and determination of care.
They can also utilize their access to Healthy Connections. And Healthy Connections, they can check on lab results, check on hospital status, and look up past medical history that we might not know about. They've also attended virtual appointments. They've been able to communicate with doctors' offices as well by doing online scheduling, also by completing forms online rather than faxing information.
RNs also have an increased ability to attend virtual meetings using the laptop. They can connect using Teams, Zoom, Ring with their laptops from any location that they're at. Also, the same applies to appointments. Staff will bring the tablets on the appointments and they will connect and provide really important medical information to the provider on the spot.
The devices really helped us during COVID because we weren't able to have as many visits to the houses. We were able to visit through the device, so this impacted the folks during that time when we're trying to stop the spread.
Most of the challenges that arose was getting the technology set up and prepared for the nurses to have the laptops, getting the tablets dispersed to all the houses, and then providing the training of use and how to connect the laptop to the tablets. Once that was completed with all the houses, use of it was more streamlined.
It's my goal to increase the number of appointments that the nurses attend virtually, especially those appointments, the specialty appointments that are out of the area. We do some as far as Buffalo, Rochester, so having them attend those appointments would be very beneficial. Also, I hope to be able to have the nurses do more assessments. Then we can do the medical care expediently. We can have someone assessed at that time. We don't have to drive there or have them assessed by someone else. They can be assessed by us.
The tablets have been used by the behavioral support department to call in and do a face-to-face with somebody during a crisis moment. And they've been able to have quick access to their app for electronic documentation. I've personally been able to utilize the tablets with the people we support that reside in our group homes because they would oftentimes like to see me and were unable to during COVID and still unable to due to all the restrictions and whatnot. So they were able to FaceTime me and talk about how their day was going, see how I was doing. A lot of the times they would sing karaoke and dance for me, and then it would actually cause the whole house to get on camera, and we would be able to communicate with them when we weren't able to go on site due to the COVID restrictions. So one of the greatest impacts of the grant is offering that flexibility and the opportunity for people to be able to communicate with people that they would typically communicate with face-to-face, but do it virtually. Now that the people we support have had this opportunity, it has now opened up the door for them to purchase their own, and a lot of people are asking, hey, can I go get my own tablet? Or can they have an iPad or another electronic device? So it's really great to see that happening amongst the people we support.
Having a tablet has made medical appointments much easier.
My name is Jennifer Hartman. I use a tablet for Dr. Lisa.
My name is Patty Bennett. So I use from my tablet.
I use the tablet to talk to Tara. I ain't talked to her in a long time. So I talk to Tara, my sister Anita, Todd, my niece Monique, and Sorrel, and Nellie. Hey.
Thank you so much for this great donation.